Okay, good afternoon. We're going to clarify a few things first, and then I'm going to go over some medical records that seem to be floating around and some interesting things that I found in these medical records. Now, the first thing I want to clarify is I did not give the date. It's obvious it was post Mica's passing, but the date is significant. I'm going to tell you why, of Allison's affidavit, which was dated May 28th, 2024. I mean, it's literally one day from a month of Mica's passing. Now, why is that significant? Well, because it seems as if almost immediately after Mica's passing, Allison, got an attorney and had this affidavit, was seeking to have visitation and custody modified and even requesting a guardian ad litem. All important, because even mentioned in the affidavit, she's saying Mica was a safety net. So now that the safety net was gone, Allison felt she needed to modify these terms and have a guardian ad litem come to a conclusion of whether it was safe for JP to even see his own children now that Mica was gone and the safety net was no longer there. Only a month later is this affidavit dated. So I find that significant. Now, regarding the guardian ad litem, the reason why I had thought that you had to be, a legal, lawyer or a law student or whatever is because my friend in Fort Lauderdale was. She was a guardian ad litem and she was going to law school at the time. She became an entertainment attorney. She has nothing to do with family law. But I just assumed that that's what it took. So that's why I said that. So there you go. But there was correction regarding that. So thank you for that. Now, let's talk about these medical records that are floating around. If you think that this proved mental illness or suicidal thoughts, you're wrong. Let me tell you what it did prove. Now, in the March 2018, which I think is shortly, it's not even a year, not even 6 months, I don't think, of her surgery, here are the symptoms. Depression, in bed all day, has no energy or motivation, anxiety, doesn't want to leave the house. It says that it reports, doesn't say who's reporting, suicidal ideation, passive. There is mention of a gun, there's mention of her harming herself, but who's mentioning it, it doesn't state. However, it says that Mica says she could not do it anyway. It's just a thought of feeling this way for the rest of my life. So she wasn't feeling good, and she was feeling very depressed and anxious over the fact that she wasn't feeling well. Is this ever going to get better? She ultimately, in that same record, denies any SI or HI, meaning suicidal or homicidal ideation. It does. This is it. This is the record where they're talking about sharing each other's meds, and whomever had seen them said, if they don't do that, there'll be a better outcome. Well, that's obvious. Okay. Anyhow, moving on to June of the same year, 2018, this is a medication monitoring form. In this medication monitoring form, it brings up this poor girl is on lithium 300 milligrams per, 1 in the morning, 2 at night, and then she's on Seroquel, half tab in the evening, 300 milligrams. Now, if you happen to come across this document, and if you look where it says other medical conditions, now, documentation is very important when it comes to medicine. They're documenting this as other medical conditions. I want you to remember that. Irregular menses. And that she's seeking to fix her breast augmentation because she's rejecting it. This is 2018, people. Now, she denies having any SI symptoms, so there's no issue of suicide at the time. But there's mention of gynecomastia. Now, gynecomastia is something you usually find in men. It's rare with women, but you usually find it in men. So what is it for women? It's abnormal enlargement of the breast tissue caused by either a hormonal imbalance or an overactive thyroid. Even birth control pills can cause these problems. This is according to Mayo Clinic and hopkinsmedicine.org. There can also be a mass. It could be also brought on by antidepressants, antibiotics, or illegal drugs like marijuana. How do you come to this conclusion? Usually through blood work, urine tests, mammogram, and a small tissue biopsy. Why this is brought up, I'm not sure. However, I do find interesting that it says other conditions, she's rejecting the implants. Well, when one rejects the implants, they usually have a revision or an implant correction surgery. That's also mentioned in this record, June of 18. Remember that date. Now, there is a condition, according to Cleveland Clinic, you can look it up, called breast implant illness. Let me read to you those symptoms. You may find this interesting. Joint and muscle pain, chronic fatigue, memory or concentration problems, breathing problems, sleep disturbance and insomnia, dry mouth, anxiety, hair loss, headaches, and depression. Now, why is this important? Early on, it's obvious that Mica was suffering. Now, breast implant illness, when you're rejecting the implant, is referred to as an autoimmune rejection. So the immune system is rejecting that implant, okay? But when you get, for example, if they would have done any testing in any of these places, meaning blood tests or whatnot for inflammation and infection, they might have found that this is what was really going on and corrected it, and she would have been fine. But what they did was they didn't even bother to rule out anything. And don't you find it kind of funny? You never see records from a clinician, meaning no gynecologist records, pap smear, mammogram, blood work, urinalysis, nothing. You never see that. You never see anything from a primary care physician. You only see things from psychologists. And I've had psychologists jump into my chat and say, well, we send out for lab tests. Well, where are they? If in the record it's stating she's rejecting her breast implant, where are those records? If somebody's rejecting an implant, there are diagnostic tests that are done. Where are they? You never see them. You know why? They weren't done. That's why. Because the narrative always had to stay depression, 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 lithium, 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 depression, 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 mental illness, mental illness, mental. This was constant. That's all you ever hear. You never hear them rule out anything. And here they're actually acknowledging under, once again, other medical conditions. She had an irregular menses, 20-something years old, didn't even bother to look into why, and she's rejecting her breast implants. Where are all these tests? Where are the hormone tests? Where are the thyroid tests, metabolic tests? Where are they? Where are they? Did she have a pap smear? Anything? Of course not. Because that would have ruled out that she had an actual bipolar depression. That would have ruled out the narrative that he's been trying to push. It would have been more of a clinical issue. So look up breast implant illness. You will find that these are the actual symptoms that Mica had. Thank you, whatever schmuck is trying to push around these medical records, because you just showed me that even they acknowledged at Waccamaw and Grand Strand, which God help any patient under these people's care. Because you just showed me that even they acknowledged as early as 2018 that this girl was suffering from breast implant illness. They put it down as a condition and did nothing but shove lithium down her throat, with no ruling out of anything. Show me where they ruled it out. You got blood tests, JP? You want to push that on? Show me the blood tests. Show me the mammograms. Show them to me. Let me see. Since you want to keep pushing out all these medical records, push out the truth. You don't have any. So there you go. I would stop pushing out the medical records because all it's doing is proving that Waccamaw and maybe even Grand Strand, I don't know if they're the same or it's two separate facilities that couldn't give a crap because they both suck, are very unprofessional. Must have gotten their medical degrees from Kmart. I don't know how they even have gone this far without being shut down, but I pray that they do. Maybe they need to be reported because they ignored from as far back as 2018 that this girl was rejecting her implants. And they acknowledge gynecomastia, which is mainly for men. But even so, if you think a woman has that, why didn't you test her? Why didn't you test the estrogen and testosterone levels? Because you didn't give a crap. Because you listen to J.P. Miller and that's all you get. He said it, you documented it. He said it, you documented it. That's all you cared about. You didn't do your job. You should have your licenses taken away. And so all these people are doing is proving that. They're proving nothing else except for the fact that Mica Miller was misdiagnosed and mistreated for the past 7 years or so by these facilities. And that there is nothing before meeting J.P. Miller and before her surgery ever wrong with her until she was in his care and in the care of these facilities. That's what you've proven. If that's what you were seeking to prove, good job. And if you were seeking to prove the opposite, well, you failed. Anyhow, with that being said, thank you and for listening, and I hope to see you soon, and God bless.